name's in this video, I'm going to be irrigating my patient's nasogastric tube. So the first thing that I would do is I would check the patient's chart to make sure that they have an order to be irrigating their nasogastric tube. In this case, I've already done that. This patient does have an order for that. So the next thing that I'm going to do is I'm going to get my supplies. All that I need for this is an irrigation kit with the syringe. This would also have the graduate cylinder and all of that stuff, and I'm going to get whatever solution I'm going to be getting in or putting into the tube as well. I don't have the solution, so we're gonna pretend it's a cup here. And then I've got a pad just to make sure that nothing gets on the patient's gown or bed. So I'm gonna bring all my stuff into the patient's room. Knock, knock, knock. Hi, Mr. Jones. My name's Reagan Siva. I'm gonna be your student nurse today. Hi, Jane. Can you tell me your name and date of birth? Perfect. And can you tell me if you have any allergies, Mr. Jones? No? Awesome. So I'm gonna put on some gloves here. What we're gonna be doing today is I'm gonna be irrigating your nasogastric tube, and all that means is I'm gonna put a little bit of fluid through that tube just to make sure that everything's clear, that the tube is working the way that it needs to be, all that good stuff, okay? All right, it might be a little bit cold, but it shouldn't hurt, okay? Perfect. Okay, so the first thing I'm gonna do is, excuse me, Mr. Jones, I'm gonna reach across you. I'm gonna raise the patient's bed to a good working height. Maybe. Is it moving? All right, well, the bed has officially broken. Anyway, but I would not throw it on the patient. I would raise the bed to a working height and put them in a Fowler's position. Hi, Mr. Jones. I'm just gonna tuck this right underneath that NG tube where I'm gonna be doing some work, okay? Awesome. So tucking that right there so that if anything were to get messy, he's not gonna get anything messy. I would probably change gloves here, wash hands, change gloves. And then the next thing that I would do is I would check the placement of the NG tube by aspirating it. I can do this a couple ways. I can check, I can't aspirate a couple ways, but I can check the placement a couple of ways. I'm gonna look right here and see where I marked earlier to make sure that the NG tube is still in the same place that it was before. I can aspirate, which I've already demonstrated in the insertion video, how to aspirate, and I would additionally check the pH during that aspiration process just to make sure that the pH of the fluid that I'm getting back is appropriate for stomach fluid, which would be about 5.5 or less. So now that I've done all of that, Mr. Jones, I am going to go ahead and get all of this, okay? So I'm gonna open my package. I've got my graduated cylinder, my syringe, my imaginary cup of fluid right here. So I'm gonna take my syringe and I'm gonna draw up 30 milliliters. And that is correct. And I'm gonna set that right there where it's available. Next thing I'm gonna do is I'm gonna disconnect I'm gonna clamp, then I'm gonna disconnect the NG tube from suction, and I'm just gonna hang on to that while keeping this clamped. Then I'm gonna take my syringe and I'm gonna insert it into this right here, and I'm gonna unclamp and gently push the 30 milliliters in here. I'm gonna make sure that I don't force it. If I were to force it, that would be really bad. But if there were any like resistance or anything like that, then I would not force, and I would try aspirating again. I would insert like 10 to 20 milliliters. I would also, if that didn't work after a couple of times, I would contact the provider to let them know. And then, so now that I've clamped, I'm gonna remove my syringe. And I'm going to put that back in my cylinder here. I'm going to reconnect to suction. Excellent. And lastly, I am going to take a different syringe and I'm going to inject about 10 milliliters of fluid into the line to make sure that everything's all clear. So I've done that, and I've done that through the vent. And then I can set this back down. Next, I'm gonna check and make sure that my suction is working again. I'm gonna document any additional intake, output into my my gastric fluid graduated cylinder connected to the suction. I'm going to make sure that everything is comfortable. Mr. Jones, does anything feel okay? Everything feel okay? You feeling any discomfort? He says no. I say great. I make sure that everything is in place still. I'm gonna remove his pad right here. I would dispose of all of my supplies. Take my gloves off. I'm gonna return Mr. Jones to a position of comfort, which would probably be semi-Fowler's, since we still wanna keep him somewhat elevated. Excuse me. And put him at the lowest possible height for the bed. Mr. Jones, we're still in PO, so that nothing has changed there, but I want you to tell me if you're feeling any discomfort or anything like that. I would continue to do just the normal maintenance for an NG tube after that, such as oral care, checking placement every shift, just all of that those normal things. And then I would chart that I had aspirated the tube, that the tube was still in the same place. So I would document that I checked placement and what the placement was with the length of the tubing. I would document the amount of fluid that I had inserted, the client's reaction, that I had hooked them back up to suction, and any additional output that happens after that. I would also document the color and pH of the fluid that I aspirated, and also document the color and fluid of any output. And I think that's it.